We've used NatureVet's Pentosan for 5 or 6 years now. We've found it very easy to use.
Pentosan to me has worked very effectively in just maintaining the horses in work.
I find results are good to excellent, and my trainers are very happy with the results.
We use Pentosan more and more, and our clients request us to use it more.
This is a presentation on Pentosan polysulfate and some recent research work that has been done showing its effectiveness in the horse. Pentosan polysulfate in the sodium form is made from beechwood hemicellulose and is a disease-modifying osteoarthritic drug. There have been studies with canine osteoarthritis showing that it reduces severity. There have been, up till recently, no published studies in the horse, but it has been used clinically a great deal in horses in Australia and New Zealand. As far as its mechanism of action is concerned, it enhances articular cartilage anabolism as well as proteoglycan synthesis, and it decreases certain metalloproteases that are involved in degrading the cartilage matrix. Pentosan polysulfate, unlike non-steroidal anti-inflammatory drugs, does not possess analgesic activities. This is based on a review by Little and Ghosh in 1996. So therefore, if it's going to be effective, it needs to correct the pathobiologic imbalances in the osteoarthritic joint. We have recently done a study in the Orthopedic Research Center at Colorado State University looking at injectable sodium pentosan polysulfate in an equine osteochondral fragment model, and this model has been used in about 10 studies evaluating different medications for joint disease. The model is based on creating a chip fragment in the distal radial carpal bone of the carpus and burring back to 15 millimeters width to create some debris in the joint, and this produces a very consistent model. The experimental design in this study was to take 18 horses, 9 served as negative controls or placebo controls, and 9 horses were treated with sodium pentosan polysulfate. The horses were paired by sex as much as possible and similar body weight. Within each pair, the horses were randomly assigned to one of 2 treatments. The treatment group received pentosan polysulfate at 3 milligrams per kilogram once weekly for 4 weeks, and the controls had saline in the same volume as PPS given to the treated horse. With results, the lameness scores in osteoarthritic limbs were not significantly different. The lameness scores were significantly different between osteoarthritic and non-osteoarthritic limbs, and flexion in effusion scores showed a lowering with treatment, but the difference was not significant. However, trends were seen in a positive way for all these parameters. A number of biomarkers in the synovial fluid and serum were examined, and in particular what we call the chondroitin sulfate 846, which is a marker of increased synthesis of chondroitin sulfate, increased with pentosan polysulfate treatment. When we looked at the histology of the articular cartilage, there was a strong trend for decreased cartilage damage with pentosan polysulfate treatment in OA joints, and the average scores were 3.2, higher meaning more damage in the control joints and 1.9 for the treated joints. There was also less chondrone formation, which is a pathologic change with osteoarthritis in the joints treated with pentosan polysulfate, and there was also significantly less articular cartilage fibrillation with pentosan polysulfate treatment. A clinical study has more recently been done in Florida by Dr. Faith Hughes, where 39 horses with naturally occurring DJD or osteoarthritis were treated. All of the horses had the osteoarthritis causing a lameness grade of over 2 out of 5. This is using the AAP grading scale. They had radiographic evidence of DJD. There were 3 treatment groups, one group receiving Pentosan Equine once every 5 days for 4 injections, the second group receiving Pentosan Equine once every 5 days for 7 injections, and the third group receiving intramuscular Adequan once every 5 days for 7 injections. Using a visual analog scale of lameness, where 0 is no lameness and 10 is non-weight-bearing lameness, as well as AAP scoring, the lameness was evaluated in these two fashions. A visual analog scale was also used for flexion, range of motion, and stride length was measured as well. The results showed no lameness scores being different between groups pre-treatment, which shows that we have a uniform groups of horses. All three treatments significantly reduced lameness scores at week 4, but assessments at week 2 and 6 showed both Pentosan groups with significantly reduced lameness scores, but Adequan not having significantly reduced lameness. Horses receiving Pentosan therefore responded faster than those receiving Adequan, and horses receiving Adequan tended to regress or become more lame again after the end of treatments on day 35 or week 6, whereas those on Pentosan maintained their improvement in the same time scale. Pentosan treatment group also showed increased stride length at weeks 2, 4, and 6, whereas Adequan treatment group showed decreased stride length at weeks 4 and 6. Pentosan treatment group showed significantly more improvement than the Adequan group at 2, 4, and 6 weeks. This is a graph of the lameness variation showing the more rapid onset of lameness reduction in the Pentosan groups, and also the fact that the Adequan lameness came back more quickly in the Adequan group. In conclusion, horses receiving Pentosan either in 4 or 7 injections were significantly less lame than horses receiving Adequan at weeks 2 and 6, which is 11 days after treatment. And in horses with naturally occurring arthritis, Pentosan reduced the clinical signs of lameness, stiffness, and stride length better than Adequan. Thank you for your attention and best wishes in your practice.
Right now in Dubai, most of the people, they are using Pentosan Equine for their horses. They have good result and they are satisfied and they are happy. It's easy and safe to use Pentosan.
But with Pentosan in my practice, we deal with a lot of thoroughbreds in Melbourne. Pentosan to me has worked very effectively in just maintaining the horses in work. Those, especially using it on young horses when they first come into work, helps maintain their joint health, and we've found it very effective.
We do a large amount of racehorse work. Matamata's probably one of the leading training centre in New Zealand. We've used Pentosan, Nature Vet's Pentosan for 5 or 6 years now. We've found it very easy to use, very safe, and we find that clinically the results are very good. And I'd highly recommend the drug to anyone for problems in horses, plus also preventative lamenesses. Thank you.
We've been using Pentosan at the Macau Jockey Club for a number of years. It's a very well accepted product amongst the trainers. A large proportion of the horses are on Pentosan regularly as part of a joint maintenance program in combination with glucosamine products and hyaluronic acid. We recommend the product highly. We've got positive results over the years and we'll continue to use the product for the foreseeable future.
I had the chance to use Pentosan in my country, in Italy. We found extremely successful this product because we are in the field of show jumping horses, and we definitely had some amazing results with the product, so I hope it will be available in our country very soon.
I've been in equine practice for in excess of 30 years and been using Pentosan for 15 of those, predominantly standardbred practice. I find results are good to excellent, and my trainers are very happy with the results.
I deal with a lot of standardbreds and thoroughbreds in my practice, and we use quite a fair bit of Pentosan. Usually we would give it once a week for the 4 weeks, and we find that we get enormous results in improving their performance, especially horses that just aren't actually showing any lameness signs but are not performing as they should be, and we find that they just grow a leg, so to speak.